Good afternoon, Evanston. My name is Ike Obo. I am the Director for the Health and Human Services Department, and I want to welcome you to our Facebook Live. For the past 2 weeks, the Mayor and I have been addressing questions and some concerns regarding COVID-19 in Evanston and Illinois. And joining me today is Dr. Lashmi Alasayamani, who is from North Shore University Health System. She is a Chief Quality and Transformation Officer there. So I want to thank you for joining us. Today we have a number of questions that were submitted for us to address, and we will go by, and I think I'll be the moderator for this one. Previously it was the Mayor, but I'll take over this time by being the moderator. So we have a number of health-related and medically-related questions. I'll try, to the best of my knowledge and ability, to address the public health questions, while Dr. Lashmi addresses the more medical-inclined questions. So shall we?
Great, let's start.
Absolutely.
Thanks, Ike.
All right, so I think the first question is for you.
It is.
Yeah.
So the first question is from Abe, and his question is, if I have symptoms, what should I do? So Abe, the first thing you should do is you should stay home. And then you should call, if you have questions, your healthcare provider, or North Shore has a Health 9 helpline. And the individuals on that line are primarily nurses, and they would be able to help guide your next steps. In general, it's very important, if you think you have symptoms, to seek guidance before seeking care. That allows you to get the best guidance and also helps to keep the healthcare workers as safe as possible.
Thank you, Dr. Lashmi. So the second question is for me. It says, how quickly is the spread of COVID-19 occurring in Illinois? It is rapidly spreading in Illinois. As a matter of fact, on average, we have over 200 cases per day, at least in the last 5 days. So I can comfortably say that we have community spread in Illinois, but there are measures that you can take in order to limit the transmission of the virus. And I know we've talked about this in other sessions, which are stay home when you are sick, wash your hands, cough into a tissue, and discard that tissue, avoid crowds. And I think if you employ these strategies, the transmission rate will be much reduced. And that's what we continue to preach. And we hope that our Evanston residents and other people who are listening, who are not part of Evanston, will employ these strategies in order for us to reduce and limit the spread of the virus. Okay. Dr. Lashmi, I think the next one is for you.
It is, thank you. So the next question, and this is from Lisa, why is this virus more contagious than the common cold or flu? So Lisa, the challenge is we're not entirely sure why it's more contagious. It's similar to the flu, to the common cold, in that it is a coronavirus, but it is different than the flu in that it is more contagious. So on average, when someone has the flu, they could pass that on to 1 to 1.5 people. When someone has COVID-19, they could pass it on to 2 or 2.5 people. The other main difference is that the incubation periods is much longer for COVID-19. And then finally, we're seeing that many more people are getting hospitalized than who get hospitalized with the flu. So we don't entirely know why, but part of the reason that we need to really adhere to Ike's public health guidance is because it is more contagious.
Absolutely. Thank you. Mm-hmm. So this question, I think there are subsets of the question. Is asking how many people in Illinois have been hospitalized with the disease, what percentage of people who contract the disease end up in a hospital, what percentage end up in intensive care, how many people have been hospitalized in Evanston so far. So this is a great question. In regards to those who've been hospitalized in Illinois, unfortunately, I do not have those numbers, but CDC on its website does have sections where it illustrates the number of people who have been hospitalized based on age. And I think you'll be able to get a lot of information from the CDC website, although it's not specific to Illinois because it is general for the entire nation. If you're looking for information pertaining to age groups, especially for those who are older, the CDC website will provide you with that information.
Okay, the next couple of questions are for me. These are from Marguerite and Nancy. Will getting a pneumonia vaccination help, and is it still available? So that's a great question. It's important for individuals who are in high-risk groups. Those would be people above the age of 65 or individuals with other kinds of chronic medical conditions to get vaccinated against a bacterial pneumonia, which is what the pneumonia vaccines protect against. We now recommend 2 of these vaccines. One is commonly called Pneumovax, and the other is known as Prevnar. They are slightly different in how they're formulated, but very important if you're eligible for these vaccinations to get them. They will not protect you against COVID-19, but they will help you against a common form of bacterial pneumonia. The second question is from Joanne, and it asks, is it true that Advil makes the coronavirus worse? So there is no definitive data that suggests that Advil makes coronavirus infections worse. In critically ill patients, we have to be very careful in using the class of medications that Advil is a part of. Commonly, these are known as non-steroidal anti-inflammatory drugs, or NSAIDs. In critically ill patients, NSAIDs can cause other complications, and so we often avoid them. But in general, non-steroidal anti-inflammatory drugs like Advil are safe and are commonly used to reduce fever. Individuals can also use other medications like acetaminophen to reduce fever as well. The third question is, can you pass on the virus if you don't have any symptoms? Yes, you can. And this is why, again, the public health guidance that Ike has reviewed in terms of social distancing, frequent hand hygiene, especially after you touch your face, touch surfaces. I sound a little bit like your mom. Use the bathroom, make your sandwich, eat your sandwich. All the key times that your hands are in touch with other surfaces, you should be using hand hygiene and practicing social distancing. Really, that's what's most critically important as we want to limit the spread of COVID-19 across our communities.
Thank you. So the next question is for me. It is from Martha. It says, is there any pattern in the COVID-19 confirmed cases in Evanston in terms of location or how it is being spread? Of the 41 current cases in Evanston, does the city backtrack and contact those that have come in contact with the confirmed cases? All right. So let me address the first question. As I stated earlier, we have to state that there is community spread in Evanston. So the most important things that we have to employ in our daily activities are staying away from crowds, staying home when you're sick, washing hands. So these non-pharmaceutical interventions, once employed, will help limit and reduce the transmission rate. The second question did state, of the 41 cases, do we backtrack and contact those who may have come in contact with the individual? Yes, and that's what we call contact tracing. When an individual has been exposed to someone who has a disease or a confirmed case, we follow up with those individuals to ensure that they are quarantined. And quarantine means staying at home while we monitor your symptoms so that you are not outside or your place of work where you can transmit the virus. There is a third question. It says, if someone in your family contracts the virus, should they stay at home or isolate elsewhere? The recommendation from IDPH and CDC suggests that you can isolate at home if you have the COVID-19, but there are some measures that have to be in place in order for this to work. One of those recommendations is for this individual to be isolated in their room and for there to be a toilet room for this individual. Another recommendation is for the individual not to share bedding, materials, eating utensils, cups, any personal items so that you can prevent the transmission of the disease. The other recommendation is for the individual who has the disease to wear a mask when that individual is in the midst of others. So if you employ these strategies, you'll be able to reduce and prevent the transmission rate of the virus. And if you are in a situation where it is impossible to isolate, isolating elsewhere is also recommended. Thank you.
Great, thanks, Ike. So I have a couple of questions. The first is from Loretta, who asks, what are the primary symptoms? So the primary symptoms of COVID-19 are very much like the same symptoms you might have if you have the flu. So body aches, fever, cough, respiratory symptoms. So again, we are learning about a broadening set of symptoms, but those are the most common symptoms related with COVID-19. The next question is from Alana. She asks, I'm pregnant and due in April. How will the coronavirus affect my labor experience? Do you expect a shortage of equipment or personnel for those in labor? So first of all, congratulations, Alana. It's wonderful that you're going to have a new addition to your family. So how will the coronavirus affect your labor experience? If you are delivering in one of the North Shore facilities, we have significantly reduced the number of visitors. We generally have a no visitor policy, but for women who are in labor, they're allowed to have one visitor who passes our screening guidelines. That includes a series of questions as well as a temperature check. Again, this is for us to make sure we are not bringing sick individuals into our healthcare environment. Otherwise, I think you will notice that you'll have a very good labor experience. Do you expect a shortage of equipment or personnel? We do not. And in fact, you should know that our teams within our labor and delivery areas are doing simulations around how they would care for patients, how they would care for patients who might present with symptoms that could be consistent with COVID-19. Again, we really have two goals. The first is to keep our patients safe, and right up there with that is to keep our healthcare workers safe. So all of us are working very hard to ensure that our personnel have the right training, the protective equipment they need, and part of that is really limiting the number of visitors who accompany patients.
Thank you, Doctor. Mm-hmm. So the next question is for me. It says, is it true that men are more likely to contract the disease? And this comes from Ellen. Evidence suggests that those who are at risk or high at risk of contracting the disease or older adults 65 years or older, those who live in congregate settings or long-term care facilities, and any adult who has some health complications ranging from liver, kidney disease, diabetes, that these individuals are the most likely to contract the disease. But I continue to emphasize the need of measures that ought to be put in place to prevent the transmission rate of this virus. Social distancing, avoiding crowds, staying at home when you are sick. So I can't emphasize it enough, the importance of these strategies, that once you employ them, we will slow down the virus. And the purpose of all of these measures is to also ensure that our public health and medical systems are not overwhelmed if we get everyone sick at the same time. So please stay home, wash your hands, cough into the tissue and throw it away, disinfect surfaces as regularly as possible for us to limit the spread of COVID-19. Thank you.
Thanks, Ike. This next question is from Carolyn, and she asks, what do we know about how long the COVID-19 virus lives on surfaces such as paper or fabric? Are food, package, and mail deliveries safe to handle? So Carolyn, what we do know is that the virus can live on different surfaces for different durations of time. So for example, on copper, it can live for maybe 4 hours, on cardboard for up to 24 hours, and on plastics or stainless steel, several days, up to 2 to 3 days. So this is why it's so important that the surface that matters the most are your hands, and that's why cleaning them regularly is the most important way for you to protect yourself. The surfaces we come into contact with will be variably cleaned, but the surface that we have control over to make sure is cleaned in the way we need to every time are our hands. So that vigilant and recurrent hand hygiene is really the most critical thing.
Thank you. So the next question, actually we have 4 questions in one, okay, and I'll start with the first one. It says, what is the city doing to ensure grocery clerks are not passing on the virus? And as you know, the governor issued an order just a few days ago, and grocery stores are listed as essential services. So we need our grocery stores to continue to function as we deal with this crisis. So the recommendation that I've been emphasizing for the longest is for the clerks to employ social distancing between them and their customers, to wash their hands regularly in situations where they can't wash their hands regularly, to use sanitizer. So once we employ these, we'll be able to protect ourselves. The other question is, does going out for essential tasks like shopping put you at risk of getting COVID-19? And this question comes from Shana. We have to assume that there is community spread. And once we realize this and put it in our minds, we'll be able to protect ourselves adequately. So as you are going to shop, try as much as possible to avoid those who present symptoms, who are sick. Try to maintain a 6 feet distance between you and others. Wash your hands regularly, use sanitizers when possible, and disinfect. If we employ these strategies, we'll be able to, again, limit and prevent the spread of coronavirus 19. The other question is, what guidelines are restaurants following to ensure safety? Again, our governor issued an order for restaurants to close. Not all restaurants are closed at this point. Restaurants where carry-out and delivery services can be implemented are not closed at this point. So in order to protect ourselves, that was why the governor issued that order, to make it impossible where you will have a number of people congregating in one space, but allowing these restaurants to continue to operate by offering takeout services and delivery services ensures that there is social distance employed. The other question is, should employers be taking the employees' temperatures? It will be something that I'll recommend, especially in situations where individuals are in industries that are essential, to make sure that this disease is not transmitted. By taking temperatures will indicate whether that person is running a high fever. If the person is running a high fever at 100.4 degrees Fahrenheit or above, the suggestion is to ensure that that person goes home. So I think it's very important that as we are creating policies and strategies, that taking temperatures for those who are essential, who provide essential services, that being employed so that we do not transmit this disease going forward. Thank you.
Thanks. It looks like you have a couple other questions over on the cards next to you.
Okay. Yes.
Just so you have those. Yeah. So the next question is from Lindsay. She asks, what is the current status of testing at North Shore University Health System? What is the current approach to testing? So Lindsay, we are proud that we have been able to bring the COVID-19 test in-house. So North Shore is able to perform that test within our lab. And that's really a testament to our lab leadership and capabilities. The current approach to testing, again, we want patients who are concerned that they have symptoms consistent with COVID-19 to call us. And through that phone call process or e-visit process, not a direct in-person process, we are able to assess whether the symptoms are mild or whether they're significant enough where we would recommend testing. What's important to understand is that even though we have testing capabilities within our health system, we must steward the resources around the testing. Because to do a test requires a swab, requires reagents, requires viral media for us to transport the swab. So all of those components are in limited supply. So if you get guidance that says, just stay home, we don't really think you need the test right now, that's in order for us to steward these resources for the individuals who are more ill or who are likely to become more ill with COVID-19.
Thank you. So the next question is for me. It states, what is the current status of ventilators and PPEs in Evanston? The question comes from Sarah. And for our listeners who do not know what PPE stands for, those are personal protective equipment, ranging from gloves, masks, gowns. So these are equipment that we need in order to fight the virus and also to protect ourselves. So where are we with PPEs? It continues to be an issue, not just locally, but statewide and nationwide, where the deficiency or the lack of PPEs continues to be a problem. We continue to work with the Illinois Department of Public Health in that regard to secure and procure PPEs that are needed for our first responders and other settings who certainly need PPEs in order to prevent themselves from contracting the virus. It continues to be an issue, and I'm hoping that in the near future that will be rectified. On the CDC website, I always refer to CDC because they provide those guidelines for PPEs and everything in regards to the coronavirus situation. On the website, they have a section where they illustrate how one can optimize the use of PPEs. So I recommend for those who are listening, if you want to understand how you can optimize the PPEs that you currently have, please visit the CDC website. It provides that information there. And I will also use this as a PSA announcement to reach all those who are listening and to others. If you have some PPEs in your custody that you are not using, please reach out to the city, reach out to the hospitals. Everyone is in need of PPEs at this point, and that will be considered a community service, and it will be certainly appreciated.
Thanks, Ike, for reminding everyone of how important that is. I have a few questions. One is from Rebecca. It says, I am over 65 with an existing condition, bronchitis. How can I be tested? Do I need a doctor's note? So, Rebecca, the first question I would ask you is, do you have symptoms? So if you don't have symptoms, there is no indication to be tested at this time. So if your symptoms related to your chronic bronchitis are stable and pretty much the way they always are, then I would monitor them and continue to do all of the things that Ike has talked about in terms of social distancing, hand hygiene, use a tissue when you cough, et cetera, et cetera. If you develop new symptoms of fever or respiratory symptoms that are different than your baseline, then I would encourage you to call your doctor or call North Shore, and we would be able to do an assessment with you over the phone or through an e-visit and help provide you some more guidance. Testing might or might not be appropriate depending on what that assessment reveals. The next question is a little bit related. It says, how soon should I seek medical care once symptoms appear? So again, COVID-19 is a flu-like illness, and for many individuals, it can be mild. So oftentimes, we have mild flu-like viral syndromes, and we take care of them ourselves at home. But we appreciate that this is a time of a lot of anxiety and a lot of uncertainty. So that's why if you want to reach out to a healthcare provider to go over your symptoms, to better understand what might be going on for you and what might be the right guidance, we have access to those providers through our phone line, e-visits and other socially distanced methods in order for us to support you and answer your questions. The next question is there a test to determine if someone had COVID-19 in the past? Can a recovered individual contract the virus for a second time? So there are tests being developed to look for evidence of immunity. Those are typically measured through immune globulins. They are not available now, and we are not sure how long it would take for individuals to even demonstrate those. It's interesting that the use of plasma from individuals who've recovered from COVID-19 is being evaluated as an experimental treatment for individuals who are currently critically ill with COVID-19. Again, all of this is really very much in a clinical trial in an experimental situation. Can a recovered individual contract the virus for a second time? So in general, the answer to that is no. However, there have been case reports of individuals who have tested positive again. I think we don't know enough to have a definitive answer around that. Right now, we are treating people who are contracting it for the first time. I think as this evolves, we will begin to learn more and be able to definitively answer that question.
Thank you, Doctor. So the next question is for me. It says, can epidemiologists estimate when cases will peak in Evanston? So statisticians and epidemiologists, given projections and disease patterns, can stipulate the angle and the avenue in which diseases are being spread, but there are a number of factors that will have to be in play here. Population size is one of them. The disease pattern is another. And also the number of cases is another. So we can gather all this information together to project what it will be in the nearest future and when that will peak. But at the same time, this is a new virus. We are learning a lot about that the virus is evolving, and it's too early at this point to speak. As I indicated early in our session, I said that the disease is rapidly evolving. We are seeing over 200 cases per day in Illinois. Today it might be the same, but this is a disease that continually evolves as we are learning about the disease. But can it be computed in a way where we can estimate a peak? It can be done, but all I'm saying is it's kind of early at this point. We have to gather as much information possible and at a long time to be able to certainly say, hey, this is where it will peak.
Thanks, Ike. The next question is, how many tests is North Shore conducting each day? What has been the rate of positive infections so far, and what is the turnaround time for the tests? So since we have been able to bring the test locally to North Shore, we are now conducting between 300 and 500 or 600 or so tests a day. And again, we are guiding people to that testing through our algorithms that help us identify individuals who are at higher risk for a potentially more serious COVID-19 infection. We are not testing everybody. We are testing individuals who we believe could have a worse outcome. The turnaround time for getting those test results is generally 24 to 48 hours. If you are hospitalized, it's much closer to that 24 hours. If you get the test as an outpatient through one of our 4 super ready immediate cares, it could be closer to 48 hours. The next question is, do you expect drive-through testing to be available? I'm happy to share that we implemented drive-through testing at our Old Orchard immediate care on Monday. And so far, we've done 190 drive-through tests. Individuals cannot just drive through. You can't say, hey, I'd like a burger, fries, and my COVID test. Every individual has to be pre-screened through our e-visit process. And that e-visit process will determine whether you are appropriate for a drive-through test. Again, individuals with a lot of chronic disease or maybe having severe symptoms, we're recommending get an in-person evaluation in addition to possible testing. But individuals whose symptoms are mild or who meet our criteria for testing, we are offering the drive-through testing at our Old Orchard immediate care site.
Good. All right, so the other question is for me. Shouldn't there be a major push to get tested if you have symptoms And Dr. Lashmi, I think you've already addressed this in the previous question. We can move on to the second one. It says, how else will we get a handle on this outbreak? The way that we will get a handle on this outbreak, and I feel like a broken record when I continue to mention social distancing and washing your hands and staying at home when you're sick, avoiding crowds. If we continue to practice these steps and these measures, we will prevent the transmission of the virus. So that's the way that we will overcome and defeat this outbreak, by employing these strategies. We've actually have started to see it work in China, and we're hoping that we will start seeing it work here in the United States if we comply with the recommendations by our public health officials, CDC and IDPH. I think we'll certainly make a headway in containing this outbreak.
Yeah, and I just want to add that sometimes we're looking for a silver bullet or something that's really fancy and extraordinary to make things better, but it's really the basic public health guidance that's going to keep us well. And sometimes it's hard to believe that in 2020, it's still important to wash your hands, but actually it is. And that was a sentinel thing that Dr. Sommerweis actually discovered many, many years ago, that hand hygiene was so important to break the transmission of infection. So we have to go back to the truths that we know. And those are very fundamental and really rest on the guidance that Ike has shared. Another question for me. This is from Craig. Is it true that North Shore has developed a faster new way of testing? So Craig, the test that we have here at North Shore is the same test that the CDC and IDPH does. It is not different from that. It's a molecular PCR test. It is not the new FDA-approved 45-minute test that you probably saw on the news. We are able to do it a little bit more quickly because we have it locally available to us, but it is not the rapid test that you likely heard about on the news yesterday. Is there a second question? Yes. How can COVID-19 be treated prior to a cure being developed? So the main ways to treat COVID-19 in individuals who have mild disease, and that's really disease that doesn't require critical care, is through supportive care. Rest, fluids, social isolation, coughing into tissues, really all the things we would do if we otherwise had the flu at home. For individuals who are critically ill, and these would be individuals who are on a ventilator and who are really struggling with COVID-19, there are some experimental options. North Shore has access to many of those options, but what's important is that there are no proven treatments for COVID-19 right now. And again, folks are going out and trying remedies that can have very negative consequences. So it's extremely important that if your infection is mild, that you support yourself with the typical supportive measures. And if you have a critical infection, you'll be hospitalized, likely in an intensive care unit, and we'll have a team really evaluating what experimental treatments you might be eligible for and could benefit from.
Thank you, Doctor.
Yeah.
So the next question is for me. And I think we probably have another maybe 2 to 3 questions to go through before this session is over. But let me state what this question is. It says, are there any plans in works to create a medical facility or utilize an unused building or hotel for care for those who are suffering from COVID-19? And the question comes from David. So at this juncture, our hospitals indicate the necessary capacity to handle the number of individuals who are hospitalized. That might change in the near future if we get an overwhelming influx of patients who need to be taken care of at the hospital. And that's why I keep re-emphasizing the need for non-pharmaceutical interventions. We don't have any antiviral drugs to combat the disease, nor do we have any vaccines. So the strategies that I keep mentioning has to be put in play and taken seriously so that we do not overwhelm our medical facilities or our public health systems with the individuals who are presenting symptoms and need care. In regards to what the city is doing, the city is currently working on a housing plan that will be rolled out very soon. And this will only pertain to individuals who cannot effectively isolate themselves at home or quarantine themselves at home. It is something that the city has been working on for weeks. And we're hoping that in the near future that will be something that we can roll out. Of course, it will pertain to the public, but it is something that we are really working on, and it's a big concern of us. So stay tuned to that effect. But the city has continued to work on this, and we're hoping that for those who cannot effectively isolate themselves to be the people who will be at the hotel or whatever facility that the city provides.
Thanks, Ike. That'll be a very important service for individuals who aren't able to socially isolate. The next question for me is from Dorothea. If a person has contracted West Nile virus in 2012, would having had that virus and surviving help that person to successfully fight coronavirus? So unfortunately, Dorothea, the answer is no. West Nile virus is a different kind of virus than a coronavirus. It's a flavivirus. So I'm glad you recovered in 2012, but it doesn't confer any protection against COVID-19.
Good, thank you. All right, so I think this will be the last question until we wrap it up. And the question is for me. It says, can I continue to go out walking with a friend if neither of us have been around anyone else? So the governor issued a stay in shelter order a few days ago. And as I review that order, it does mention that walking is an essential activity. So as you're walking with your friend, social distancing is still important. So you can indeed go walking, but ensure that you are taking all the precautions necessary in order to protect yourself. The other question is it okay to be in a gathering of dog owners, 5 or so, while maintaining proper social distancing so that the dogs can play? And this comes from Jeff. In that order, it indicated that 10 people or more are prohibited. So in this case, if we have 5 people and social distancing is maintained, that should be okay. In this regard, if you're walking your dog, according to the order, it qualifies as an essential service or an essential activity in this regard. So just be mindful that you are supposed to avoid crowds in order to prevent contracting this virus. And as you're outside, maintaining social distancing is very, very paramount. So I want us all to be cognizant and mindful of that as we are outdoors, maybe hiking or walking. But at this point, team sports are prohibited. So we are not encouraging in any regard any team sports. Playgrounds are prohibited at this point, but the parks are open for people who want to walk. But like I said, be mindful, make sure that you maintain social distance, and employ all the strategies that I've been mentioning throughout this session.
Thanks. Actually, I had one last question here. Yes, thanks for that. So the last question is actually from Hallie. And she asks, besides staying home, what can we do to support the overtaxed medical system? I would say staying home is really an important part of that. And the other thing is, if you know someone who's working within the healthcare field, tell them you appreciate them because people are working really hard to do the very best they can. So if you don't hug them or do anything that would, affect the social distancing, but giving them a call, sending them a note, I think would be greatly appreciated. So thank you for that question.
All right. So this is the end of our session, and thank you for those who wrote in. I hope that this session has been beneficial to you and useful to you, that you will use the tools and the information that we've provided to you on your daily journeys as we continue to fight against COVID-19. And until another session, you have a pleasant day. Thank you, everyone.
Thank you.